This is Dr. Stewart from Timonium Foot and Ankle Center, and I'd like to discuss custom foot orthotics. Custom foot orthotics are custom-made devices made specifically for your foot and your condition that are used to address biomechanical factors that lead to foot and ankle problems. The way our foot and ankle moves and our lower extremities moves and our hips move and our knees move and our back moves really dictates and leads to the problems that we see in the foot and ankle. Common conditions that we treat with custom foot orthotics are plantar fasciitis, posterior tibial tendonitis, Achilles tendonitis, bunions, peroneal tendonitis, flat feet, people who have pain associated with flat feet. There are multiple conditions that we use orthotics for. Our patients who have diabetes with neuropathy or patients with neuropathy unrelated to diabetes are at higher risk for developing significant foot deformities and can get pressure spots and sores and wounds. And we can utilize and fabricate these great devices to help support the foot, offload certain areas. Offload means remove pressure from certain areas to really prevent progression of wounds, and that's how we can salvage and save limbs. So custom orthotics, I'm going to show everybody a little picture here, just what they are, and then I'll pull up some orthotics. They're devices that we make. These are just a few of the devices that we make, and we have these kind of stacked up. This is more for a women's dress shoe. This is more for a sports shoe. This is for a men's dress shoe, and I have some samples that I'm going to hold in my hand and show everybody. But what is important to understand is that everybody's foot is different. So there are certainly over-the-counter products, and in certain cases, over-the-counter products can be beneficial, but keep in mind that not everybody's foot is the same. And when you are going to purchase something over the counter and you take your shoe size, you have to remember and keep in mind that an orthotic, which, here's an orthotic. If you look on the bottom of an orthotic, there's the orthotic actually starts at the heel and ends right here. Now, the problem is that, most people have different heel to metatarsal lengths. And when you take an orthotic out of the box, just because you're a size 8 shoe does not mean that your size 8 orthotic is going to line up properly with your foot. There are also a lot of other factors that go into looking at how we make an orthotic. We take measurements when we do a proper foot exam. We want to know, is your heel straight up and down? Is it rectus, or is it invalgus? Is it turned in, or is it invarus? And if that's the case, we make modifications to the outside of the shell so that your foot is held in the position of comfort, which is the neutral position. We want to try and hold you in a position that eliminates the symptoms associated with the condition that we're using to treat. We look at the forefoot, we look at the front of the foot, we look for abnormalities in the alignment of the bones, we look for callus patterns, we look at the way that your feet are hitting the ground, and we want to try to offload, again, take away pressure from all of these areas. And we also can utilize our x-rays to really look to make sure that certain bone lengths are proper, and if we need to make adjustments in that, and if there's arthritis in certain joints, we want to make changes associated with that. So understand that orthotics are really they're a specialized process. It takes a lot of knowledge and understanding of foot and ankle biomechanics, which I really have gained and learned a lot over the years from doing this. And we can really utilize orthotics to effectively treat the majority of foot and ankle conditions in a conservative fashion. And that's really important. It's pretty amazing how you can take a device like this and avoid surgery and function well and get back to running and get back to doing the activities you like and not suffer with chronic foot and ankle pain. So, if you come into our office, you'll always hear me say you have to think of things in two components. You have a problem, you always have to treat the problem. I don't really use orthotics as a front line of treatment. Orthotics should really be used as the back end of treatment and the longer term treatment, because what you're doing is you need to utilize other treatment plans to calm down the initial condition that you came in for. And then we transition you into orthotics, the proper shoe gear, and orthotics are made in all types. This is a sports device. In our practice, we used to, when I first started practice, we used to scan patients we used to cast patients for orthotics when I first started practice, which we would take a plaster mold of the patient's foot. We would hold it in the corrected position. It was messy, and we would send it to the lab, and we run the risk of the cast getting broken. And the technology has really come along where we now take a three-dimensional image of the foot, and we can send that file over email with our prescription, and within a few weeks we have our custom orthotic back. They come in all types of materials, and that is determined based on a discussion that I will have with you. This is a polypropylene material, a more rigid material made for running, sports, athletics. Here's an example of a dress orthotic, which has a little more give to it, and this can fit more in a dress shoe. For our patients that are diabetic or have neuropathy, we can utilize materials that are softer so they're not hard and rubbing and creating pressure spots, because we don't want to put something in a shoe that actually makes the condition worse. We want to offload. We have high impact orthotics for sports, and I'm only showing you guys a few of these. There are probably about 20 different types of orthotics that we can make, and that is certainly determined by your condition, your needs, and what we actually are trying to achieve. And the important thing to understand is that, although orthotics generally come out the right way, there's a little bit of wiggle room, and sometimes we need to make adjustments and corrections. And one of the things you can feel reassured is that we will always get it right. We will make every effort. If we have to send the orthotic back to the lab multiple times, all we ask is that you're patient, and we will get it right. Part of the great thing about our lab performance, which is who we work with, is that they have a guaranteed fit for the first 6 months. So as long as you come into our office before 6 month period is up, there is a guaranteed fit. They will guarantee that they fit your foot appropriately. And we will make sure that we follow through to get it right for you and help your condition. So custom orthotics are a great, conservative, non-surgical way to treat your foot pain. I wear them myself. I've had bad plantar fasciitis before. When I don't wear my orthotics, I know it. They definitely took some getting used to, and I tell all the patients the same thing, but we have patients coming in all the time for orthotics. They've been wearing them for years. Over time, they will wear down and they will require replacement, and that's all really based on how much you utilize and wear them. And I think that most people who have had great success with orthotics will tell you it's a great non-surgical, conservative way to treat your foot and ankle pain. So we'd love to help you with orthotics, getting fitted for orthotics. If you'd like to learn about orthotics, come into the office to get fitted for orthotics. Feel free to fill out a submission request on this page or give the office a call. Thank you.